So there's a question about saying, what about the case of a 9-year-old on hydroxyurea who's very compliant and still experiences pain? So I can talk about that. So I think pain is a very complex experience. So it's, so I think it's important. And one thing that may fit for one person may not be the best option for other person. So there may be other things that can be, and I cannot speak for this particular child, but I can tell you, we do have some of the individuals who may have very high burden of pain, despite being on hydroxyurea or not. We are not able to explain why this child may be having pain. And many of these individuals actually, how to deal with pain has helped quite a bit, meaning like, so especially working with psychology quite a bit. And at our institution, we are able to also use some of the non-pharmacologic measures. So making sure the person sleeps well, how is their sleep hygiene? Can they use acupuncture or acupressure and things like that? So many of our patients have responded very well. And I think this age is really important, young age. And I actually am very proud of one of our patients whom I saw yesterday. Last year, this child missed, she's now 14 years old. Last year, this child missed about 6 months of school. She could not go to school. And I just saw her yesterday with acupuncture and just like, some of our working with our psychology team, this child has missed only like 5 days from, this year in 2022. So that is remarkable, but I think it is important to work with psychology team or your medical team to see what may be the other factors. Does this have does this person have like gallstone? Where is the pain and what may be the other factors that may be contributing?
Great job, Deepika. Can you hear me?
Yes, thank you.
So there clearly are non-sickle cell disease factors that may contribute to the pain. Dr. Darbari has already mentioned one. What's actually fairly common in children, specifically, and also in adults, is the presence of asthma. About 1 in 5 children to 1 in 4 children have asthma. And the literature is actually fairly well documented that children with asthma have a higher rate of acute chest syndrome and have a higher rate of pain. This has become so commonly recognized that many programs, sickle cell disease programs across the country, particularly in pediatrics, have developed a joint pulmonary sickle cell disease clinic to abate or to decrease the rate of vaso-occlusive pain. So we would be remiss if we didn't at least acknowledge that a common second comorbidity, asthma is a second disease, occurs frequently in individuals with sickle cell disease, and uncontrolled or undiagnosed asthma is in fact associated with an increased rate of pain and particularly acute chest syndrome. So that's number one. Number two is that stress. There's no question at all that individuals who are at increased risk for stress, be it recent divorce of the parents, be it poverty, which in and of itself is associated with stress, will have an increased rate of pain. Recently, there's an article that described 2 young ladies who developed chronic pain syndrome after they were sexually abused. And within months after that abuse, both of them came to the hospital anywhere between 15 and 20 times a year, when before they were only averaging 2 to 3 times a year. So clearly the stress plays a role. For our older adolescents and adults, depression is a major precipitator of pain. And so as we continue to understand more about the disease, there are still medical reasons why individuals with sickle cell disease may be classified as having chronic pain or the like. And I'm always reminded of the fact that individuals with sickle cell disease are just like any other individuals, and they can be susceptible to the level of pain that others have for non-sickle cell disease reasons. For instance, there's a young man that I talk about constantly who had chronic back pain. And the reason he had chronic back pain was because he was playing PlayStation every day. And as the mother said, quote unquote, every waking hour of the day. And so anybody, whether they have sickle cell disease or not, who's in a hunched over position with bad posture, that's sitting in front of a television for 16 hours a day is going to have chronic low back pain. And so we have to help our families describe the pain that occurs, and so that we can actually distinguish the pain from other sickle cell pain from other pains. And the last point I want to make clear is that it's quite clear when you listen to our young ladies who have started their menstrual cycle, that maybe about a quarter to 30% of our young ladies will have vaso-occlusive pain independent, associated, with their menstrual cycle. And we have several young ladies that we've put on birth control to stop their menstrual cycle. And this in turn has stopped their acute vaso-occlusive pain. So there's a range of reasons, and it really takes a open discussion between the provider and the patient and the family to identify these triggers so that we can prevent the pain and not subject them to therapy that may actually cause more harm than good.
Yeah, those are very important points, Michael. Thank you. I agree completely. Arrey, there's a question for you. What was your experience like in emergency room?
I would say I had a pretty normal experience in the emergency room. I mean, a lot of times when I went to the emergency room, I was like in excruciating pain. So I was often triaged to the top of the list. I mean, there were a few times where I experienced long wait times, but I feel like that's pretty common in the ER. But beyond that, I feel like most times that I went to the ER, I was triaged to the top of the list and seen fairly quickly compared to most other patients.
Thank you. And I think there may be some differences, and I'm not able to clearly comment on that, but pediatric, and mostly it was pediatric emergency department, Arrey, that you went to, or that.
Yeah.
So there may be some differences, but it probably would be helpful to hear from adult patients who may have gone through the adult ER.
Yeah, I mean, it also helped that a lot of times I just went straight to Children's National. And so a lot of the providers there already knew me. So when they heard that I was in the ER, I think that kind of facilitated the process even more.
Yes, okay. There's a question asking for about this child with pain. How do you differentiate between acute and chronic in such cases? So there are ways of classifying the acute and chronic pain. So acute pain, as the name suggests, you get the acute episode of pain and you get better. And most of the time you are pain-free between 2 episodes of pain. But once a person develops chronic pain, so the big umbrella definition, if someone is having pain more than 50% of the days and their pain scores are about 5 or 6 or more in past 3 to 6 months, that is the definition. But then person has to work with their physician to identify what kind of chronic pain this may be. There's a question, I think for this could be general audience, that for those who have gone through the treatment, do you feel, and Arrey, you can respond to that as well, do you feel it would have been beneficial for you to have transplant earlier in life, such as preschool age, knowing now what life is like before and after?
I mean, strictly speaking, in terms of pain experience, yes, I would rather have gone through transplant early in life because obviously it would have saved me a lot of agony in childhood. But I don't think I would appreciate the value of the transplant as much if I went through it earlier in life, because I guess what I'm trying to say is that my experiences as a child kind of shaped me into who I am today. And so I think those experiences, although painful, were valuable for me into making who I am. So I think I would rather have it done just strictly for the pain, but otherwise than that, I would say I'm grateful that I got to have it done at all.
Thank you so much, Arrey.